Good afternoon, ladies and gentlemen. My name is Barry Schmidt, and I am the coordinator of the Bay County Prevention Network. And just as a reminder as well, I coordinate the group called Project HOPE, which stands for Hearing Opiate Prevention Elimination. And I wanted to give you an update on what's being done regarding the opiate issue, because we know that the overdoses continue to be a problem, an issue in our community. And a lot of people think that nothing's being done. So let me give you an idea of some of the organizations that are working together first and foremost. So we have the Bay County Prevention Network, and on that Project Hope group consists of Basic Public Safety Department, the Peer 360 Recovery Alliance, List Psychological, Saginaw Psychological, the Great Lakes Bay Families Against Narcotics, Great Lakes Bay Health, and Recovery Pathways. Those are the organizations that are currently involved in doing some projects and activities within the opioid scope of the Bay County Prevention Network. So, what's going on currently? What I can tell you right now is we do have a 6-year plan that is available. Anybody would like a copy of it, we can give you a copy of that 6-year plan, which includes reducing stigma with an emphasis on the healthcare industry, as such as hospitals and physicians, etc. So today, regarding the issue of stigma, we have done door hanging campaign where we went into the South End of Bay City and did about 300 to 500 different houses, letting them know that 1 in 10 individuals that has an addiction in their neighborhood, and giving them resources where to get help. We've also done a Chances Are workshop for the faith community, where we gave a 3-hour presentation talking about opioid issues, as well as resources, interventions, and talking about language and regarding stigma. We did a 3.5-hour presentation to McLaren Bay Region's culture, diversity and inclusion team, where myself and Kyle Hanshaw from Recovery Pathways talked about different levels of stigma, words that matter, and what the definition of stigma is. And by the way, that workshop is available free of charge to any organization that would like it. We currently are in discussions with a presentation on January 12th with the McLaren healthcare system to talk about the issue of stigma in the Chances Are campaign, Chances Are workshop. We also have scheduled January 19th a presentation with the Department of Health and Human Services in the Bay and Aranac areas, as well as those in that field of service, where we will talk about words that matter, and we'll talk about how to have discussions with individuals suffering with substances to assure them that they're going to, number one, not be judged, and number two, to help them get into treatment services as well. So that's on the Chances Are stigma side. Another goal that we have was to increase the availability of educational opportunities. So we have provided, once again, those workshops I talked about. We've given diptera pouches out and had discussions with individuals for that as well. And we've given about 10 or 15 lock boxes to the Department of Health and Human Services in the area as well. Talking number 3 goal would be to, and our ultimate mission of this group, by the way, is to have a quarter or a month where we have 0 overdoses. We're not there yet, but here's some things that are being done to help to get to that level. Number 1, we partner with the McLaren Bay Region Pharmacy Department, and our pharmacy champion, Sean Duchesne, has been great at doing the work behind the scenes of all this. But we're to the point where probably the middle of January, we'll be launching a new initiative with the hospital, McLaren Bay Region. Thank you again for that. In the emergency department, starting out, that every individual that goes in the emergency room for an overdose will receive a Narcan kit, which will include Narcan kit itself, a QR code that has a training video on how to use it, as well as resource material that will be put in a bag for them. So they'll get all those. By the way, that is pretty groundbreaking because on a study that was just done recently, I believe it was University of Boston, only 7.4% of the United States is doing something like that. So we're going to be in the forefront of that endeavor. So thank you again, Sean, for all that work on that. As well as we've been working with the Michigan Public Health Institute and our medical examiner to look at fatality reviews. These would take a look at de-identifying data to make sure that we can get individuals that have died from overdoses and be able to pinpoint maybe what the root cause was. That root cause will help us then to be more strategic and intentional when we're developing programs, services, and interventions. We recently collaborated with the Bay State Public Safety to do a quick response type team where individuals that have been called from the police department side because they had an overdose, we're going back with the police department, making sure it's safe. And then we have team members, recovery coaches, family recovery coaches currently that are volunteering, and we are in the process of hopefully securing a grant from the city of Bay City. Hopefully this time next month to be able to tell you that's true, where we'll be able to fund that program completely, but individuals go into the home and help them find out what's going on, let them know they're there to support them and get them services, resources, as well as helping them to get into treatment. And that treatment component can be done through the Holt 9 Handcuffs program, which has entities around the state. Another one we're working on as well is we may have a residential treatment facility that's only for men that looks like it might be starting possibly sometime next year as well. So that's good news. We continue to work with the Neighbors Against Drug Abuse and Peer 360 Recovery Alliance and the Families Against Narcotics to bring sober living or sober housing, recovery housing to our community. And in January, we'll start having discussions, community readiness, as well as organizations that are already interested in it possibly, but there is a lot of funding behind it. So we have to be cognizant of those things and make sure we're following the evidence-based practices regarding that. So those are some great things going on. We continue to build capacity. We received a capacity grant where we'll be using what we're going to call an advocacy ambassador, which will be visiting the Citizen District Council as well as other community meetings to recruit individuals to help with the issue of the overdoses and opioids. So if you're interested in being involved in that, please let us know, because advocacy is really an important part of that process. So prevention isn't just about giving information, but it's also about enhancing support, giving support systems, changing policies. Those are all things that we're looking at, making sure that we're doing so we have a more comprehensive approach. So what we are continuing to do and what is coming up is we're going to be working on a Chances Are marketing campaign to make sure that that messaging is getting out where we want to get out, those focused populations that we're talking about. We're going to be revising our community toolkit we put together a few years, I think it was 2015, 2016. We're going to be revising that. We're looking to take our Bay County Hope and our Bay County Prevention Network website and merge those two into one. So that will be called baycountyhope.org, which will have information on opiates, underage drinking or alcohol, marijuana, underage youth, especially, as well as prescription drugs and other substances emerging. So that'll be coming up. We're continue to be thankful of the data collection that we get from some of our partners as well. We're going to continue to expand that analysis. We are creating 90-day plans that are being accomplished in part right now successfully. What I can tell you is the QRT and the Narcan hospital. The Narcan hospital was like a year project, we figured, but it's very much being fast forwarded, be the best word to say. And the QRT team we were trying to do, even without the funding, we had training and all that already on it. It's amazing. It's gone forward. We were looking at a 6-year process for that. And the sober housing as well, we were looking at 6 years for that. And that seems like it's going to move forward as well. So we're really excited about this. And we're going to start talking about an opiate conference as well. So those are just a few of the things that are going on at the Project Hope Group. If you have any questions about any of those things, you can call us at 989-316-4120. Or you can email me, Barry, B-A-R-R-Y .Schmidt, S-C-H-M-I, D as in dog, T as in Tom, at mclaren.org. You can also message us on our Facebook page. So with that said, on behalf of the Bay County Prevention Network, Bay County Project Hope team, we wish you a Merry Christmas and a Happy New Year. Be safe out there. And remember, help is only a call away. People need hope, not shame. Take care.